I need someone who has mastered the basics. Or you don't have to master the basics. If you have given a good reading, one good reading in your MBBS or BAMS or BHMS or BUMS or PharmD, that good reading is enough, because we can build your knowledge of Prism framework over that, and then get you the knowledge on different all the different domains, so that you become a uh, Prism professional. And that's exactly why we partner with IIT, so that we now kind of present this two important courses, which is common for technocrats, for data scientists, for life sciences people, and also for doctors, MBBS, BAMS, BHMS, BUMS, BNYS, and BSMS, all, because the first two semesters or the first two courses are for students who will what will happen at the end of the 8 months. You kind of get all this knowledge. I'm not saying you will get entire knowledge, but you will be introduced to all of these 12 different domains. You get a hands-on the device. You understand how the device functions, the algorithm behind it, the way it gives you a very impeccable clinical decision. And once you have the clinical decision, or you can start building, because we also train you on some aspects of Python programming, so that you start building this device further, because we need programmers with domain expertise to build the next generation digital technology. So that's exactly why this divided into two layers of program. The first two semesters or the first two courses are for students who will what will happen at the end of the 8 months. You kind of get all this knowledge. I'm not saying you will get entire knowledge, but you will be introduced to all of these 12 different domains. You get a hands-on the device. You understand how the device functions, the algorithm behind it, the way it gives you a very impeccable clinical decision. And once you have the clinical decision, or you can start building, because we also train you on some aspects of Python programming, so that you start building this device further, because we need programmers with domain expertise to build the next generation digital technology. So that's exactly why this divided into two layers of program. In the first course, which is the basic course of Prism framework, we teach you the basics of Ayurvedic medicine. Ayurvedic medicine that intersects with modern medicine, number one. And Ayurvedic medicine, modern medicine, the intersection of these two, not only with these two, but these two intersection of these two medicines, sciences, with fundamental research protocols, then translation research protocols, applied math, data science, and Python programming, and your coding skills, and lab technology methods. Because the lab technology methods, what do you mean? What I mean by that is that how is the machine calibrating your blood glucose when you go give your blood in the lab? They do a lot of lab tests and come up with your blood biochemistry and so on. Those methods also will be taught, because that also is a part of this Prism framework. And once you get hands-on this, then the second course will essentially teach you how to diagnose a disease. And there are 12 different disciplines: the heart disease, the refractory diabetes. There are 12 modules, again, of clinical division. There's a clinical divisional modules in which we give you a thorough understanding of how to diagnose, treat, and cure end-stage patients with heart failure, refractory diabetes, refractory hypertension, kidney failures, liver failures, autoimmune diseases, end-stage cancers, psychiatric diseases. Rheumatoid arthritis is a separate course. These 12 different clinical disciplines, you will get hands-on with at least 50 patients of data. 50 patients, you're going to curate them. You become curator for this 50 different patients. and in 12 across 12 different clinical disciplines, so that you get a fair understanding of what the PRISM framework is. So the doctors get an entire basic foundation, so that you can start working in a certain location of your choice, and we start training you further to become a PRISM partner in the next 2 years and 4 months. That's how we evolved this PRISM educational program. Will then translate into your Novodyne franchisee program. This PRISM course, according to, is very close to my heart, because this is like Tom Cruise's Mission Impossible. You're pretty much on the edge. Your patients are on the edge. You are on the edge, and you've got to exactly do what has to be done so that the patient survives. And that is why what happens is, what happened in several end stage patients, not me, the government, the Ayush ministry had done a trial on 16,000 patients, and all of the 16,000 patients died. And the result was, they mentioned that in end stage disease, Ayurveda doesn't work. That's the conclusion that they made. I don't agree. Because if you practice herbal medicine as opposed to Ayurvedic medicine, then you get results. Ayurvedic medicine will give results. But what is Ayurvedic medicine? Ayurvedic medicine means that medicine which brings about samadosha, balance of these three agents, sama agnishcha, sama dhatu malakriya, which means when you bring about a balance of the three doshas in all of the 7 tissues and 42 organs, then sama agnishcha, the agnis in the body, they're the 13 agnis, they get to a state of balance. And when that happens, sama dhatu, the dhatus, which are the tissues, physiological tissues. Tissues in the modern medicine and Ayurvedic medicine are different. In the modern medicine, tissues are based on histology, and in the Ayurvedic medicine, tissues are based on physiology. That's very interesting. So the samatva, or a balanced functioning, physiological functioning of a tissue and organ systems happens. And when that happens, whatever the body doesn't need is excreted. That's why the algorithm goes like this. Shloka goes like this: sama dosha, then sama agnisha, sama dhatu, malakriya. That means mala means excretory waste. So the malakriya, excretory waste, gets eliminated from the body automatically. You don't have to do that. See, for example, you eat food. Do you keep measuring the pH in the stomach? You don't measure that. The gastric juice is automatically secreted. So when does that happen? When you have samatva. That's the key here. And again, this is point number 1 to be made. The point number 1 is, if you maintain samadosha, then the body enters into a state of self-healing mode and results in prasanna atma indriya manaha, which means it leads to physical, mental, emotional, social, spiritual well-being. So how do you measure these vatas, pittas and kaphas? Are very, very critical, because vata, pitta and kaphas are 15 types. There are 5 types of vatas, 5 types of pittas, 5 types of kaphas. The body has about 7 million chemicals participating in about 8,000 chemical reactions, resulting in about 80,000 physiological processes, and you're single-handedly, it's worse than Magadhira. एक को नहीं 100 को भेजना है that kind of effect you've got to have. You are literally Magadhiras, and this is not just one single Magadhiras in you, because you're at a time fighting or maneuvering. You have to defeat or balance 7 million molecules. You need at least 70,000 Magadhiras in one you.